This presentation I call COVID Risk Factors, Diabetes, Fear, and Age. In this presentation, I'm going to have a little summary of some research, an abstract, and then some charts and tables. So there's some new research out, and it's from the Preventing Chronic Disease, Public Health Research Practice and Policy. It was a total of, I think, 20-some doctors in there, as well as just being published in July of 2021. They looked at underlying medical conditions and severe illness among 540,667 adults hospitalized with COVID from March 2020 to March 21, so one full year during the heat of the crisis in the U.S. Well, what's a summary? What is already known about this topic? They say severe COVID-19 illness in adults has been linked to underlying medical conditions. So, what is added by this report in this cross-sectional study of 540,667 adults hospitalized patients with COVID-19, 94.9% had at least one underlying medical condition. Hypertension and disorder of lipid metabolism were the most frequent, whereas obesity, diabetes with complication, anxiety disorders, and the total number of conditions were the strongest factors for severe COVID-19 illness. You may be saying, wait, what? Anxiety disorder? Huh? I can understand hypertension and lipid and diabetes. Let's read on. So what are the implications for public health practice? Preventing COVID-19 in populations with these underlying conditions and multiple conditions should remain a public health priority with targeted mitigation effort and ensuring high uptake of vaccine when available in these individuals and their close contacts. Let's continue on to the next section where I look at the abstract of this paper. So, severe COVID-19 illness in adults has been linked to underlying medical conditions. This study identified frequent underlying conditions and their attributable risk of severe COVID-19 illness. The method of this study, they used data from more than 800 U.S. hospitals to describe hospitalized patients age 18 or older with COVID from March 2020 through March 2021. So no kids in this one, all over 18. The method, well, they used a multivariable generalized linear models to estimate adjusted risk of intensive care unit admission, invasive mechanical ventilation or IMV, and death associated with frequent condition and total number of conditions. Now here they're looking at three main things, right? They're saying, what's the risk of getting admitted into a hospital? What's the risk that when you're in that hospital, you're going to get a tube shoved down your throat? That's an invasive mechanical ventilator. And number three, what's the risk that you're going to die? Those are the three things they looked at. And then they looked at the number of conditions, underlying conditions under that. So let's look at the results. Among 4,899,447 hospitalized adults, okay, so there was already 5 million people hospitalized in America. Only 540,667, or 11% of them, were patients with COVID, of whom 94.9 had at least one underlying medical condition. Soon we'll look into the chart and I'll show you more about this. Now, essential hypertension, we'll just call it hypertension, also called high blood pressure. This was 54% of the disorders. The disorder of lipid metabolism was 49, and obesity was 33. These were the most common three type of disorders. So high blood pressure, cholesterol, and obesity, basically. So the strongest risk factors for death were obesity. You have a 1.3 times higher chance than someone with no underlying factors of dying if you're obese. That's the adjusted risk ratio. Now, the next one is the one that's really the shocker. Anxiety and fear-related disorders, you have a 1.28 times higher risk of dying because of COVID than a person who has no underlying conditions. And finally, diabetes with complications, 1.26. So we can see that those three, obesity, fear, and diabetes, are very destructive for COVID cases. So actually, what's fascinating about that is fear is what everybody felt over the last 12 months. Now, the total number of conditions with adjusted risk ratios of death ranging from 1.53 for patients with one condition to 3.82 for patients with more than 10 conditions. So now we're just looking at the number of conditions that they had. If you have one condition, earlier we just looked at the top conditions, but if you have one condition, it's 1.53 higher chances that you're going to die. And the condition, if you have more than one condition, right, for patients, or sorry, more than 10 conditions, you're going to have a 3.8 times higher chance that you're going to die. So the conclusion, certain underlying conditions and the number of conditions were associated with severe COVID illness. And hypertension and disorders of lipid metabolism were the most frequent, whereas obesity, diabetes with complications, and anxiety disorders were the strongest risk factors for severe COVID-19 illness. Careful evaluation and management of underlying conditions among patients with COVID can help stratify risk for severe illness. Now, let's go into the final part. I put together some charts from this. So let's first look at underlying conditions. And what you're going to see here is the top line is total, and that's the total number in each of the categories. There was 4,899,447 people that were hospitalized in America. 540,667 were COVID patients, and out of that, 249,522 were admitted into ICU. 76680 had a ventilator, and then 80,000 died. Now let's just look at the breakdown here. What we can see is that 99%, all the way to the right, 99% of the deaths were with people who had greater than or equal to one underlying factor. Only 1% of total COVID deaths died that they had no underlying factors. That means 740 people in this 12-month period in this result died that they were healthy and they didn't have any underlying factors. That's fascinating. Let's dig into that a little bit more, and we can see if we break it down by the number of underlying factors. Again, we can see if you had 0 underlying factors, there was only 740 people out of 80,000 people in this data set who died who had no underlying conditions. And then when we go up to 1, it's 2,807 and 87, right? I'm looking all the way here at the, let's see where I'm looking. I'm looking at, let's see if I can give myself a little pen. Just looking at this area of the deaths right here. And what we can see is that 2,087 people died that had one underlying condition. And then if we go on to 2 to 5, that's 32% of people. If 6 to 10, 39%, and greater than 10, 29. There's people, 20,000 people died that had greater than 10 underlying conditions in this data set. Let's look at age, because that's something we just can't control, not yet at least. Here what we can see is that if we look at the percentage of people at a young age, let's just say, I'm going to pull up my pen again here, and I'm going to say, let's just look at young people right here. So young people in this category, we're talking about 18 to 39, only 1,299 people, that's 2% of the total deaths in this data set were people that were between the ages of 18 and 39. That's relatively young. Even when you go up to 40 to 49, it's 2,700. Really, you add those two together and you can say that 5% of total deaths in this data set came from people that were 49 or under. Wow. Now let's go to the other scale, and where we can see that it starts to really be significant is in the category of 75 to 84. And in this category, we can see 23,000 people died. That's 29%. And also, obviously, over 85, equal to or over 85 was 21,000. So clearly, after you get over the age of 50, your risk starts to rise, but it really rises if you're over the age of 65. So from this, we can see that people with comorbidities are at serious risk, and people who are older are at serious risk. Now let's look at the adjusted risk ratio based upon the underlying condition. What you can see is obesity. If you're obese, you have a 1.16 times higher chance than someone with no underlying conditions to be admitted into ICU, a 1.5 higher chance to get ventilator, and then a 1.3 higher chance to die. And if we look at anxiety, it's 1.14 for ICU admits, 1.37 for ventilator, and then 1.28 for death. Diabetes with complications is 1.16, more likely to be admitted and more likely to have a ventilator at 1.43, and then slightly less likely to die at 1.26. Finally, chronic kidney disease. For admission, it's small, but for deaths, it could be high at 1.21. All of that is compared to a person who has no underlying conditions. So now let's look at the final chart. This is the adjusted risk ratio here. And what you can see is the line, the vertical line here, right here. That's the base, and that is a risk ratio of 1. That means someone that didn't have underlying conditions. And what we can see here is that outcome, the one I care about, is death. And we can see that, as we can see, if you have greater than 10 conditions, you have a 3.8 times higher chance of dying. In fact, all the way over here, you can say that this area is the high risk of death if you have 2 to 5, 6 to 10, or greater than 10. That summarizes this research, and I found it very fascinating. It just came out in April. I hope you do too, and feel free to leave any questions. If I got anything wrong, I'm not a medical doctor. I'm just an analyst trying to add up the numbers. Have a great day.